Supradyn compensates for the deficiency of vitamins and microelements. It is used in the prevention and treatment of hypo and avitaminosis and lack of minerals. Supradyn contains 12 vitamins combined with minerals and rare elements that are important factors in metabolic processes. Vitamins are necessary for the metabolism of carbohydrates, the formation of energy reserves, the metabolism of lipids, nucleic acid and proteins, as well as for the synthesis of collagen, neurotransmitters. Active ingredients. Vitamin A is necessary for normal growth, is involved in the formation and maintenance of the structure and function of bones, teeth, and skin, participates in the synthesis of visual pigment. Vitamin B1 normalizes the activity of the heart and contributes to the normal functioning of the nervous system. Vitamin B2 promotes tissue generation processes, includes skin cells. Vitamin B6 helps maintain the structure and function of bones, teeth, gums, affects erythropoiesis, and contributes to the normal functioning of the nervous system. Vitamin B12 is involved in erythropoiesis, contributes to the normal functioning of the nervous system. Vitamin C is involved in the formation and maintenance of the structure and function of bones, teeth, and gums, strengthens the walls of capillaries. Vitamin D3 regulates the exchange of phosphorus and calcium in the body, facilitating the absorption of this substance in the intestines, their timely deposition in the bones. Vitamin E ensures the normal functioning of red blood cells, protects cell membranes from damage. Biotin takes part in metabolic processes, promotes the absorption of protein. Pantothenic acid is involved in the metabolism of fats, proteins, and carbohydrates. Folic acid is involved in erythropoiesis. Nicotinamide takes part in redox processes, provides the transfer of hydrogen and phosphate. Calcium is involved in the formation of bones and teeth, contributes to normal blood clotting. Magnesium is involved in the formation of muscle and bone tissue, and also takes part in protein synthesis. Iron is involved in erythropoiesis. It's an important component of hemoglobin, which provides oxygen transport to tissues. Phosphorus, along with calcium, is involved in the formation of bones and teeth, as well as in the processes of energy metabolism. Manganese contributes to proper bone mineralization. Copper is essential for normal red blood cell function and iron metabolism. Zinc is part of about 70 enzymes involved in the synthesis and metabolism of hormones, as well as the division and interaction of immunocompetent cells. Molybdenum is part of the enzymes and coenzymes involved in many redox reactions in the body. Indications. Supradyn is used for vitamin deficiency in the following cases: with increased need, growth period, pregnancy, breastfeeding period, old age, convalescence period, antibiotic treatment, chemotherapy cause, with reduced intake, hypocaloric and other unbalanced diets, old age, gastrointestinal diseases. Under these conditions, there is rarely a lack of only one of the vitamins. In addition, the flow of the most common minerals and rare elements is disrupted. The drug Supradyn was created as a multivitamin complex that helps prevent vitamin deficiencies, allows them to be treated, as well as prevent diseases and maintain the mental and physical conditions of the patient. How to use? Assign 1 effervescent tablets per day. Dry days are taken after meals, without chewing, with plenty of liquid. The effervescent tablets is dissolved in a glass of water. Contraindications. Hypersensitivity, including allergy to one or more components of the drug, in the presence of hypovitaminosis A and D, hypocalcemia, renal failure, during treatment with retinoids, children age up to 12 years. Special instructions. Patients taking other medicinal products should consult with their physician before taking Supradyn for possible interactions. The recommended dose of the drug should not be exceeded, since very high doses of some of the ingredients of the drug, in particular vitamin A, vitamin D, iron and copper, can have an adverse effect on the human body. Do not take other multivitamin preparations at the same time. Side effects. Allergic reactions to the components of the drug, rash, swelling of the face, shortness of breath, redness of the skin, itching, blisters. Shock. For coated tablets also from the digestive system, pain in the stomach, intestines, constipation, diarrhea, nausea, vomiting. From the nervous system, headache, dizziness, insomnia, nervousness, metabolic disorders, hypercalcuria.